As a pediatric gastroenterology practice, we see a variety of conditions. We see kids who aren't growing well, who have difficulties eating, poor appetite, belly pain. So a whole host and variety of conditions. It's not really specific symptoms. Sometimes it's just, why is my child not growing? Or why is my child having difficulty stooling? Or why are their stools loose? And it's sort of a puzzle sometimes to put that symptom together with the diagnosis.
We see all ages of kids, anywhere from newborns all the way up through college kids. And we take care of a lot of different types of complaints. Probably the number one complaint we see is abdominal pain, but really anything having to do with the intestinal tract, and that can be things that are silent and asymptomatic but concerning to the general pediatrician, all the way up through things that have really eroded the quality of life of the kid or of the family that we're taking care of.
Parents want to know if their child's abdominal pain or whatever symptom it is something to be worried about, and whether this is a disease and if this is going to get worse with time, and what they can do to help that go away or get treated, and if not, at least what can they do to make their child feel better.
Could my child have a food allergy, or is this problem a manifestation of a food allergy? Could this be celiac disease? Could this be Crohn's disease? But probably the number one concern actually has nothing to do with what's the label of this. It's make it go away.
I start by asking them what brought their child in to see me. And then I start piecing those together, and I ask more questions about each symptom, and then I try to put them together, and I ask about things that might make it worse, or sort of trends that they've noticed, and I have to ask about what else, is happening in the family, if there are other medical conditions in that family. I look to see if any previous testing has been done, and I look at all those results, and if something I feel has been missed, I may add more tests to what's already been done, and then I do a really thorough examination on the child, and then at the end of the visit we try to loop it all together, and I try to come up with at least a rough idea of what may or may not be going on with this child.
It's integrating a lot of information simultaneously, sizing up the patient, their age, their developmental state, how verbal they are, how forthcoming they are with information. I think the key step is trying to integrate the intangibles, which often helps figure out what we're going to do.
The most important thing that we do today is to make your child feel better and get answers for you. It's our hope to use tests wisely. And so if we find that whatever your symptom is can be treated without having to do a lot of complicated tests, we're not going to do them if we feel that they're not going to help your child get better or feel better.
For some patients, there are lots of tests that we need to do. And I think for children as opposed to adults, there's a premium on being elegant with testing, because you don't want to subject a young child to lots of testing that may be uncomfortable, risky, and then not high yield. My style is to try to work my way up the ladder of invasiveness, starting with the least amount of invasive testing first, and getting there if we need to.
At every follow-up visit, we ask if what we did at the last visit made any difference and improved the child. And it's wonderful when we hear, yes, that a bellyache that had been there for years, with a little bit of help from us, we were able to cure that bellyache, or we were able to figure out what that bellyache was from. And that's, I think, one of the most satisfying things that I hear back every day, and that's why I do what I do.
The invited feedback has been helpful for making our practice run better, for giving services or making sure we have available services to families. But the more rewarding part is getting the feedback that you didn't necessarily ask for, and it is nice to have families come back and let us know how well they're doing.
The most important thing to know about the pediatric gastroenterology team at Swedish is that we're passionate about what we do. We went into this field because we love kids and we love the field of medicine.
We have found a way to give you the answers that you need, work up your children to get the answers that you need, but also giving you time. We're very good at judicious use of our time, and we give you a lot of it.
We're detectives and we go after the answers, and if we're not satisfied with our own answers, we're not going to stop. We're very thorough and we're very careful, and we rarely miss anything.